good morning. Hi there, this is Gilbert here. My producers in the studio, it's Azura and Achu, and we are with you. Remember, on Mondays, it is Health on Traxx. This is Gilbert here, and we're going to be talking to our guest in the studio. That's Dr. Lee Man-Wai, who is the Medical Director, Consultant, Ophthalmologist, and Retinal Surgeon, LECI Center. And today's topic, really interesting, myopia. Now, if you have short-sighted, especially at an early age, well, we'll be dwelling into our topics and our questions today. Now, just to let our listeners know, guys, don't forget, we happen to be on social media platforms, YouTube and TikTok. It is TRAXXfm Official, and on Facebook, it is TRAXXfm. So today, tackling a very interesting topic. Now, many of us are aware that this particular, well, I should say, shortness that we have or short-sightedness that the younger generation has, and myopia, silent epidemic. Currently, as much as 30% of the world's population and 20% in Malaysia are myopic. So getting into our questions today, but just before that, we would like to get to know the good doctor here in the studios with us on Momentum. Different days, different themes, and on Mondays, it is Health on Traxx. Very good morning to you, Doctor. Dr. Lee, I'll be addressing you as Dr. Lee. Doctor, could you just tell us a little bit more about yourself before we get into our topic of the day?
Sure. Good morning, Gilbert.
Morning, Doctor.
Thank you for having me on TRAXXfm. So I'm an eye surgeon. As you say, ophthalmologist is a very long word, and you just call it eye surgeon. I think it's easy for the public or the audience to understand that basically I'm a doctor and I'm a specialist in eye care.
Okay. So anything to do with the eyes and well, whatever problems that we have.
That's right.
But today it's about short-sightedness. And okay, so the doctor did explain to us, and from LECI Center. Doctor, getting into our question for today. Now, will myopia be a major problem in the future, given that the case is increasing at an alarming rate among the younger generation? You know, when we talk about short-sightedness with the young generation, and that's our topic for today. So what's your take, or what's your point of view on this one here?
I think your question was, will it be a problem? I can tell you that it is already a problem. So we call it a silent epidemic because, you know, the world has just come through one epidemic, and that was COVID.
Right.
I think we may have forgotten about it already. But along the way, I think, unfortunately, myopia has been creeping along. So what is myopia? I think you mentioned earlier, short-sightedness. So that term everybody understands. So what it really means is that, you can't see well for far. When you look far, it's blur, but you can see for near, and you need glasses. So you're wearing glasses, perhaps you're myopic. So today what we want to do is to try and let people understand a bit more about this short-sightedness. Can be as simple as just putting a pair of glasses on and you can see well. But the flip side of it can lead to potentially blinding conditions. And right now, I think, you have some statistics in front of you. I think there are projections for the coming up to 2050. You can go up to almost half of the population of the world. You can imagine how big that number is. It's going to be short-sighted. So I think that's what we want to focus on.
And Doctor, now how about people? How do people develop myopia? I mean, is it a lifestyle habit that causes this particular problem?
Yeah, I think that's always not an argument, but the thought about nurture and nature, right? So nature by means that there's always a genetic element. I think if you happen to have of a particular race, I think we know the South Asians, particularly the Oriental race like myself, Chinese, or they are a little bit more prone. I think there are genetic studies that show that. So if you have parents that are short-sighted, then you're more likely to have children that become short-sighted. But the big part of it, the nurture part of it, is where our environment plays a big role. So environmental factors, right now, I think, no thanks to the smartphone, the digital devices that we have. Everyone's watching on TikTok, Facebook, YouTube. They're probably using their computer or their phones. And that itself is a big contributor to myopia and short-sightedness.
They just like to turn off the lights and start staring at the phone and things like that. Without filters, that also probably, I don't know, could probably be one of those problems that many of us, or probably something that we're not aware of, Doctor.
Correct.
Okay, Doc, moving on to our next question now. What is myopia, a high myopia, and the potential complications associated with it?
Yeah. So just touch on a little bit like your previous question. So I mentioned about digital devices. That's the current environment that we live in.
Okay.
But really, I think it's not just recently that people have become short-sighted.
Right.
But essentially, it's about near work. So when you're actually focused on perhaps reading, used to be books, now it's more on the phone or iPads and stuff.
Right.
So basically focusing for long periods at near objects or to read or to computer to do work, that's what sort of generates short-sightedness and what makes the eye actually grow longer and become short-sighted.
All right.
So when you talk about high myopia, so I think when you make, those who wear glasses will understand very easily. You go to an optician or go to an optometrist, you make glasses, and they tell you, oh, you got 100 degrees, 200 degrees. You know, so they tend to quantify the power based on the number of degrees.
Okay.
So in medical terms, when you reach 600 degrees, it's considered high. So what happens in the high myopic or the very long eyeball in these eyes, they become weaker as we age. I think the body ages, and unfortunately in those instances where your eyeball is higher myopia, 600 degrees or more, then you're more likely to develop certain conditions. For example, you can develop glaucoma, you can develop retinal detachment, you can get bleeding in the retina, you can get cataract early, and all these are potentially blinding diseases, which people have not really linked with myopia or high myopia, and we're trying to raise awareness that, you know, we should try to control because these eyes, because we're dealing with huge numbers. Like in 2050, you got half the world's population with myopia, so billions, and you got a small percentage of them high myopia. It could be, you know, less than 5%, but that's already very huge number. So we're worried about that. Yeah.
Okay, but figures here show 20% in Malaysia. Oh, wow. And then in the whole world, it's 30%. Just to let you know that myopia itself does not cause blindness, but according to doctor, if it's not treated, it will, right?
If it's high myopia, and you can't really treat myopia. So what happens is right now, I'm trying to tell people that it's not actually a disease. It's a condition, or it's something where if you wear glasses, for example, corrective lenses or even contact lenses, you can't see well. So it does not mean that your myopia, you have a disease. No, you have a condition which affects your vision, but when wearing glasses or corrective lenses, you can correct your vision. But when you're talking about high myopia, that's when the diseases come in later on in life, usually.
Right.
So that's what we want to talk about. So it's not so much about treating myopia. It's more so about preventing progression to high myopia.
Right.
And to be aware for those who are already highly myopic, it can be 600, 700, 1,000 degrees. Currently, your listeners, some of them there, please be aware that you may be at risk of problems. Not high risk, but be aware so that you get your eyes regularly checked. And if we pick up problems, we can treat them early. So that's the idea, yes.
Very important, treating it early at an earlier stage. Thank you so much to Dr. Lee Manwai, who is the medical director, consultant, ophthalmologist and a retinal surgeon, and he is from LEC Eye Center. We'll be talking more to the good doctor, and this is with regards to more of the questions. Can myopia progress to vision loss, so on and so forth. And can myopia cause night blindness? That's kind of an interesting. We'll be talking about that when we come back. Stay tuned. This is TRAXXfm Momentum Health on Traxx. Very good morning. Welcome to the show. This is TRAXXfm Momentum. It is held on Traxx. Different days with different topics from Mondays till Thursdays. Today, talking to Dr. Lee Manwai, who is the Medical Director, Consultant, Ophthalmologist and Retinal Surgeon from LEC Eye Centre. And it's a very interesting topic, especially for those of you who are, well, with this situation, okay, which is short-sightedness, better known as myopia. And talking to the doctor where it is said that 30% of the world population are myopic and 20% of them in Malaysia are myopic, especially concerning children who are becoming short-sighted at an early age. So Dr. Lee did explain to us what exactly is myopia. And now getting into our topics, but just before that, reminder here to our listeners, we happen to be on our social media platforms, YouTube and TikTok, it is TRAXXfm Official, and on Facebook, it is TRAXXfm. Welcome back, Doctor. Very good morning to you, Doc. And Doctor, after knowing all what is myopia, Doctor, how can myopia progress to vision loss, or probably might not lead to vision loss, as you did explain just now? What are the various stages of problems that can one encounter while having myopia?
I think if you talk about diseases which are linked to myopia,
right,
I think that usually comes on later in life. So, as we age, our body ages, so our eyes do age as well.
Okay.
So if you're above 600 degrees, we call it high myopia. Okay. So you're slightly more likely to develop conditions, as I mentioned earlier, like glaucoma, which can blind. It's a condition where pressure within the eye can cause damage to the optic nerve.
Right.
You can develop retinal detachment, and that's my area of expertise, because the retina is like the nerve layer of the eye.
Okay.
And it's a bit more weaker in very highly myopic eyes, and it can be prone to detachment, and you need surgery for that. And you can get bleeding conditions because the blood vessels also get weaker, and inside the retina you can bleed. It can affect certain areas which are have very big impact on your vision.
Okay.
So all these are the diseases that you can get with high myopia. Okay. Not just myopia itself. I don't want everyone to just hear myopia and think that you're going to get blind straight away. No, it doesn't happen.
Right.
Just want to raise awareness that you are slightly at risk if you're high myopia, more than 600 degrees, and you should be aware and get your eyes checked. And more importantly, if you're a child or you have a child that's short-sighted at a young age, then we don't want that progression to come on.
Okay, right. So that's how important having your eyes checked, and if you can, do it frequently. Doctor, can myopia cause night blindness?
Well, night blindness is something that usually, it's a general term, but a lot of the time when we refer to it, it's usually a retinal disease where you have certain cells called photoreceptors which are damaged, and usually it's a genetic link. Okay, it's a genetic mutation, or it's something that something happened during the formation of the fetus or the embryo during the time when we're still in the mother's womb, and you're born with this defective cells in your nerve layer in the retina.
Right.
So no, it's not directly linked. I mean, myopia does not actually lead to night blindness.
Okay.
And that's one thing that I want to say. So don't worry about that.
Okay. Doctor here, just one more question now. How do we address the risk of myopia, given our increasing dependence on digital devices in our daily lives? I mean, many of us are into our devices. You did explain this just now, but how do we address the risk of this particular problem that we have?
I think firstly with any problem, I think we have to first identify that it is indeed a problem, and that's the whole point of today, to mention that myopia is a problem that we're going to be facing more and more because of the devices. That's one. And what's very apparent for me as a practicing doctor, seeing eyes every day in my clinic, is that after the COVID pandemic, I'm seeing children getting short-sighted or myopic at an earlier and earlier age. Now, why is that? Because there was lockdown, people couldn't go to school, and then you have online lessons, and it's become the norm. So from the COVID pandemic, we learned a lot of new things to actually make in terms of healthcare anyway, change our practices. We still wear masks and all that, where we didn't before. And the schools and the education system has also changed in a lot of ways. Because as much that, for the workforce, people can work from home now. It didn't used to be a normal thing. And now you can have online lessons for schools. And there's a lot of emphasis on, using digital devices to teach. So our children are put at risk because when you're actually having to focus on these devices to do your work and complete your work following the school curriculum, you're more at risk of developing myopia. So having said all that, so answer your question, how do we manage that risk? So if you are parents or a family member or you have children that are very young, 5-6 years old, usually the age where the crucial age, so to speak, between 6 to 12, primary school. So that's where, if you do have short-sightedness, that's where the progress is rapid, most likely to be. Now, if you go beyond, does it mean that once you get to secondary school, you're okay? No, it's just the fact that on the whole, your child is more likely to have a big acceleration in your short-sightedness during the primary school period if they are already short-sighted. So as a parent, what can we do? We try to restrict that time on those devices, which is near impossible now. I think we know that because our life is so ingrained, or rather the phone or the digital device so ingrained in our lives. So one, being aware. Second, try to restrict those time spent on the devices. And the last thing that we don't do much of is to have our children go outdoors. There have been studies that show that outdoor time spent outdoors actually helps to slow down the progression of myopia. There is really no special tablet or drop or anything to reverse myopia. So once you're short-sighted, unfortunately, you can't say that you do something and your power is going to get less. No. So right now, whatever we do is to try and prevent that progression to high myopia. So that's very important to, that's why get your children screened early. If they have myopia, try to get on board to control, their environment so that they don't progress too quickly.
Okay, so that's very important, having an early detection and of course getting your eyes checked all the time is very important. Doctor, this one here is not in our questions, but just off the record, right? I did read this, but please correct me if I'm wrong. When you stare at greeneries, trees or leaves or plants or anything like that, does that help improve your eyesight?
That's a very good question, in the sense that it's a very popular myth. So, we have actually parents that say, I get my child to look out at green objects. Right? So I think that where that came from is more than likely if you do happen to be looking out the window, not in the old days, maybe not so much in KL, you're looking out the window, you're looking at buildings anyway.
Concrete jungle.
Yeah. So I think the green part is usually when you see grass and fields and stuff. So essentially what that's doing is looking at distance objects. So you're actually relaxing the eye, because actually when we do reading, there's a very involuntary muscle that helps you focus all your things to actually read, bring it into focus. So it's that focusing mechanism which is postulated or proposed to be the reason why it stimulates myopia. To be honest with you, there's still a lot of research going into what actually causes it. Nobody really knows. You just know that it's associated with near focus work. So when you look at green objects, so to speak, actually you're looking in the distance. And that's what's actually helping to relax the eyes. So there's a very simple, if you look in Google, as people always talk about, a 20-20-20 rule. So every 20 minutes, if you can, look at something 20 feet away for 20 seconds.
Wow. Okay.
So actually, who can do that? I'm not sure whether you can, because you need to remember, every 20 minutes that you have to look somewhere farther away just for 20 seconds. So that actually helps. It's good practice to try and hopefully, release the stress on your eye and,
not strain it so
the
much.
strain, that's right. Yeah.
Okay. Some digital devices have features which can reduce blue light exposure. Okay. Now, how effective, doctor, is this particular feature in protecting your eyes? Having filters.
Yeah.
My glasses is filtered.
Yeah, I think that's quite common. I think actually, all the digital devices, when you look at it, it's white light. So the light that comes out from the screen is usually a white, bright light.
Yeah.
So that, as we know, white light has got a spectrum of different colors. So when you talk about blue filtering, it's because that one is what is the blue spectrum of it that's coming through most. Now, there have not been actually really a concrete scientific evidence where the research has done a lot into seeing that blocking that light will definitely, help with myopia. But what's logically or practically likely important is that the light that's coming through, when we stare at it a long time, you actually get tired. So the strenuous part of digital eye strain comes when your eye gets tired, it gets dry, and you might get headache and discomfort. So a lot of glasses now have this blue blocking thing, and I think it's common practice. I think it's fine. It's just to understand that filter does not help to prevent progression of myopia or short-sightedness or help to reverse it or anything. So, don't say, I have this filter, I have a filter and then it's fine, so I should be protected. No, that's not the case.
That's not the answer to it.
No.
Right, when we come back, our final question to Doctor. Stay tuned. This is Health on Traxx Momentum. Welcome back to the show. Gilbert here on TRAXXfm Momentum. And today, very interesting topic. It's Health on Traxx Mondays. And different days, different themes on Momentum. Mondays right up till Thursdays. We happen to be on YouTube, TikTok, which is TRAXXfm Official, and also on Facebook, TRAXXfm. And our final question here, talking to Dr. Lee Man Wai, who's the Medical Director, Consultant, Ophthalmologist, and Retinal Surgeon. Our topic today, myopia. And of course, this is becoming very alarming, especially with the 20% of Malaysians have this particular issue, I should say, which is short-sightedness, and it is an early stage for the earlier generations or the younger generations. So that's alarming, and Doctor did explain to us everything here with regards to myopia. One final question here, Dr. Lee. What role can parents or guardians play in preventing digital eye strain and myopia? And can the tech industry play a part through corporate social responsibility? That's the CSR programs. How does all this work out, Doc?
I think great question to end the segment, I suppose. So parents, as I mentioned, I touched on earlier. Right. I think the first thing to be aware that this could potentially be a problem for our children if it's not controlled. So we talked about earlier how to control progression by reducing near work or reducing screen times, going outdoors, spending time outdoors. There are studies to actually prove that. So of course that's the prevention part from progression. Now there are research, or there has already established treatments to try and to start on the child simply with glasses. I think when we make glasses, there are special design glasses for children that can help to reduce the speed of progression. We've talked about contact lenses as well, even for children. Not that common, but yes, it can be used. And more so, there are eye drops now that actually can be used to try and slow down the progression. And the most recent one is the use of a form of red light therapy. They talk about it, and this is evidence-based as well, to show that these different strategies are in place to help parents actually manage to slow down the rate of progression, not to reverse. As I mentioned, once you have short-sightedness, you can't do anything to make it go away. Your eye is going to have short-sightedness, especially in children. We want to slow progression, so there are all these strategies in place where the eye doctors are aware of and can help to actually treat or manage the children that way. But the main thing, of course, is what parents can do at home is to try and restrict the time spent on all these devices as much as possible, and try and encourage outdoor activities.
Right. Those are the common do's and don'ts, and it's so sad to hear that there's no cure.
No, it's not a cure, because there's no cure, because like I mentioned, when you talk about cure, you're associating myopia with a disease.
Yeah, we're not.
So it's not a disease to speak, but it is a link to potential to cause disease later on. Correct. Yes. Yeah. So I would say that it's not a curable thing in the sense, because it's not a disease to be cured. Right. It is a condition that you have that we have to manage. So in order to manage it now, all these strategies are in place, and I think it's most important to be well informed. So when you're well informed, you can actually act on it. Yeah.
Eye drops, red eye treatment, and things like that.
Red light treatment.
Treatment. Yes. Thank you so much. Thank you, Doctor. And that will end our program right here on TRAXXfm. Second hour of the show. That's TRAXXfm's Momentum, Health on Traxx. Thank you so much, Dr. Lee. Thank you for being here with us, and thank you for being a fan of Liverpool.
Oh, thank you so much. Yes, you'll never walk alone. Thank you so much, Gilbert.
I was waiting to say that right after the interview. Okay, so now it's a bit more casual. Yes. Going out to our listeners. Well, guys, it is 2-0 with the Citizens. Wow.
Yes, definitely.
And I would like to say hello to one of our friends here who just happened to be one of my colleagues, and I always admire him, especially when he gets on reading the news. Darren, how are you, my man?
I'm good, thank you.
Okay, I don't know whether some of you remember that voice, but yes, Darren Atkinson, right here on TRAXXfm with Dr. Lee. Thank you so much for joining us on the show. Remember, it is TRAXXfm's Momentum Health on Trax every Mondays. YouTube, TikTok, it's TRAXXfm Official, and on Facebook, it is TRAXXfm. Now, thank you so much to my producer, Achu. We've got Azura here in the studios, and it is a build-up to news coming up at midday. Stay tuned. This is TRAXXfm.